Welcome to today's Explainer. Okay, we are going to dive right into this because it's absolutely crucial. Cardiovascular disease is still the #1 cause of death globally. But you know what's truly terrifying about that? It's largely a silent killer. For way too many people, the very first symptom they ever get is a catastrophic event, like a sudden heart attack or a stroke. Now, the standard doctor visit, where they check your blood pressure and run a basic cholesterol panel, that is incredibly important. But as we're going to see today, that standard checkup often just looks at the tip of the iceberg, completely missing this massive, really dangerous structure lurking just beneath the surface. And that brings us to a really provocative question. It's actually one of the biggest medical mysteries of our time. Why do people who are told by their doctors that they are low risk still suffer from heart attacks? Seriously, how does someone with perfectly normal standard lab results suddenly just have a massive cardiac event? Well, the answer is that our standard metrics are often creating a dangerous illusion of health. They're basically waiting for the disease to fully develop, rather than catching these subtle, early drivers of the dysfunction. So, to figure this out, here's our clinical roadmap for today's Explainer. First, we'll unpack the illusion of normal. Second, fasting insulin as an early warning. Third, LPA, the genetic wildcard. Fourth, spotting hidden arterial plaque. And finally, taking back control. All right, jumping into section 1, the illusion of normal. So, conventional medicine generally waits for disease to be diagnosed before acting, but we really need to be looking for root causes way before a crisis hits, right? And this brings us to a concept that brilliantly shows why looking deeper is so vital: the compensatory phase. You see, your body is amazingly resilient. It can compensate for years, sometimes literally decades, before a system actually fails. Think about your standard fasting glucose or A1C test. It might look perfectly fine on paper, but down beneath the surface, your cells might actually be becoming resistant to insulin. To keep your blood sugar looking normal, your pancreas has to work overtime, just pumping out massive amounts of insulin. And this elevated insulin, it's silently driving inflammation and accelerating plaque buildup, all while your standard labs are giving you a totally clean bill of health. Moving on to section 2, fasting insulin, our early warning sign. If standard glucose tests are missing those early signs, what in the world should we be looking at? Well, the answer is fasting insulin. It's one of the most underutilized tests out there. And just look at the shocking gap here between what standard medicine calls normal and what is actually optimal. On a standard lab report, they'll tell you a fasting insulin level anywhere from 2.6 all the way up to almost 25 is perfectly normal. But you have to remember, standard reference ranges are just a statistical bell curve of the people being tested. And let's be honest, right now, a huge chunk of the population is already metabolically sick. In the functional medicine world, the true optimal target is actually under 5. Let's break down these thresholds really quick because it paints a much clearer picture of what's going on inside you. Like we just saw, under 5 is optimal, 5 to 9 is acceptable. But look what happens when you hit 10 to 14. We are already seeing early insulin resistance. By the time you hit 15 to 20, you've got significant insulin resistance. So the absolute kicker here is this: your standard lab could hand you a result of 20, tell you everything is totally normal, and just send you on your way. They're completely ignoring the fact that you actually have marked insulin resistance that's actively driving early heart disease. Wild, right? All right, section 3, LPA, the genetic wildcard. Now, while insulin resistance is super heavily driven by our lifestyle choices, LPA is a whole different beast. It's an independent genetic wildcard. It's determined from early childhood, and it actively drives plaque buildup, blood clotting, and even the narrowing of your heart valves. And the tricky part, it doesn't respond to standard lifestyle changes or even those first-line statin medications. But despite how dangerous it is, check out this stark statistic: 0.5%. Right now, only 0.5% of people in the United States are actually tested for LPA. Because there haven't been targeted therapies to lower it in the past, it just literally hasn't been on most doctors' radars. But thankfully, that's starting to change. Researchers over at Yale are actively working to fix this massive testing gap. Because, it's hard to just blindly test absolutely everyone. So they've developed a machine learning model that actually scans electronic health records to find the people who are most likely to have elevated LPA. They found that this genetic risk usually hangs out with some specific clinical indicators. So if a patient is a woman, if they're Black, if they have hypertension, a history of premature heart disease, or a family history of cardiovascular disease, their risk goes way up. By using this AI tool, doctors can literally cut the number of unnecessary tests in half, while zeroing in on the exact patients who are at the highest risk. Which brings us to section 4, spotting hidden arterial plaque. So, how do we actually spot the physical evidence of this disease before it's too late? We can use non-invasive imaging. Things like coronary artery calcium scores or CAC scores, which are specialized CT scans, and carotid ultrasounds that look at the arteries right in your neck. This data from a fascinating Argentine study of about 350 primary prevention patients brilliantly illustrates why these scans are a total game changer. The researchers calculated everyone's traditional risk score. Now, look at the group categorized as low risk. On paper, these folks shouldn't be worrying about heart attacks at all. But the physical scans, they told a completely different story. 33% of those low-risk patients had a coronary calcium score above 0, meaning physical plaque was already building up in their hearts. 22% had plaque in their carotid arteries, and over a quarter of them had that dangerous genetic wildcard we just talked about, elevated LPA. And here is the ultimate plot twist of this entire study. Based purely on standard clinical data and those traditional risk scores, only 33% of the people in the study were candidates for protective statin treatments. But when the researchers factored in all those hidden modulators, the calcium scores, the ultrasounds, the LPA, nearly half of the people who were initially told they didn't need medication got reclassified. 47.2% of them actually had enough hidden risk to warrant treatment. By simply looking below the surface, they caught a massive chunk of the population that standard tests missed entirely. Finally, Section 5, taking back control. Now, I really don't want you to view these hidden risks as a reason to panic. Not at all. Discovering them is actually a massive, empowering opportunity to change your trajectory. The whole point here is taking action. So, how do we fix things like a skyrocketing fasting insulin? Well, it starts with lifestyle. First, you've got to aggressively reduce refined carbohydrates and ultra-processed foods to stop driving that massive insulin secretion. Second, engage in resistance training. Your skeletal muscle is basically a giant sink where your body disposes of glucose, so building muscle directly improves your insulin sensitivity. Honestly, even a daily walk makes a huge difference. Third, prioritize your sleep. It's totally underrated, but poor sleep acutely drives insulin resistance. And finally, manage your stress. Chronic stress elevates cortisol, and that just tells your body to pump out even more glucose and insulin. To wrap up today's explainer, I want to leave you with this really powerful quote from functional medicine practitioner Steve Grant. He says, "Our genes load the gun, but our lifestyle habits are what pull the trigger." You might have a family history of heart disease, or maybe even that genetic LPA wildcard, but your daily choices dictate how those genes actually express themselves. So the question is, are you going to wait for the standard medical system to tell you something is fully broken, or are you going to demand the right tests to see the whole iceberg today? The choice is entirely yours. Thanks so much for joining me, and I'll see you in the next explainer.